friends lives in Baltimore. Yeah, she lives in Baltimore, so I had planned on going to see her because friends lives in Baltimore. Yeah, she lives in Baltimore, so I had planned on going to see her. Hey, hey, hey! I'm here based out of Atlanta, Georgia. Um, I am Ama. Hi, everyone. I am Ama. I am your host today for Pregnancy Beyond TV. I am so excited to get started with you guys today. We have Tiara from Birth CEO. She is a certified doula and also an IBCLC. So we'll learn all about that. But she has such great things to bring to you guys.
I made
Yes,
it.
yes,
Hi.
yes. How are you?
I'm good. How are you today?
I'm doing well. Thanks for asking. So,
Awesome.
how do I pronounce your name?
Sierra.
Pierre. Okay, I said it right the first time.
Yeah.
Awesome. Awesome, awesome, awesome. Where are you based out of?
I'm based in, Maryland, but I serve like the DC, Maryland, Virginia area.
That's awesome. My one of my best friends lives in Baltimore.
Oh, okay.
Um, yeah, she lives in Baltimore. So I had planned on going to see her before COVID, but then we know life
We
shut
know
down.
how
So.
that goes. We
Right,
know.
right, right. But we are so excited to hear all your information. So,
Yes.
yeah,
Thank you for
you
having me. Thank
got
you. Hi, everyone. I'm Tiara. I'm the owner of Crowned and Cradled. I offer doula services, lactation consulting, childbirth education, and a little bit of fertility coaching as well. So I saw some people on here trying to conceive. I'm wishing you the best and lots of baby vibes for you as you tune in today. So today I just kind of wanted to give you some information about just postpartum infections and pelvic pain. I do have to make a disclaimer that anything that I share should not be taken as medical advice. You should always refer to your provider, whether it be your midwife, family doctor, or OBGYN. I'm just here to share some common things that we see in the postpartum period, and I'm open to any questions that you all may have during the broadcast. So let's get started. So when we talk about postpartum infections, it's kind of one of those topics that we don't talk about, right? Like we focus so much on the pregnancy and childbirth and becoming a parent and even breastfeeding, but with a lot of things, as you'll see once you do have babies, you kind of forget about yourself in the process. So the postpartum period is no different. Like you get so caught up in making sure the baby is fed, making sure that, we say that we want help from people after we have the baby, but sometimes we end up entertaining those people, when they come to visit and help. So we kind of forget about ourselves in the process. So today I'm just going to share some common things that we do see. I also needed to add that I am a nurse as well, so things that I'm saying are evidence-based also. So just trying to make sure I cover my bases here. So let's talk about infections in general and, what are the common signs and symptoms that we see. So, of course, the big one everyone usually says first is what? Fever, right? Fever. Anything above, I would say, around 100.4 in the postpartum period is something that, and I mean Fahrenheit, is something that you may want to give your doctor a call and just see, talk to them and see if there's any other things that you may be missing. Fever is always the first telltale sign of infections. Another thing is pain, right? So this could be headache. This could be abdominal pain. This could be pain in the pelvis. If you have had a C-section, it could be pain at the scar. Any pain or feeling like your abdomen is swelling, which a lot of times that's what it is. Your uterus is actually swelling from being inflamed by an infection. You need to give your doctor a call. Foul smelling discharge. So, You do bleed a little bit after you give birth. So if you notice that the discharge that you're having isn't smelling right, isn't looking right, to you the color is off, you may also want to contact the provider and just, see. Another one, chills, headache, that feeling where you just are like, something is not right. All those things could be signs of infection. So each infection that I talk about today, those are the signs: pain, fever. Sometimes people have nausea, dizziness, headaches, and just that off feeling when you kind of know something isn't right. So the most common infection, well, the one that we talk about the most, I would say, is UTIs, which are urinary tract infections. Urinary tract infections are not the most common postpartum infection, but they do happen. And there's a lot of different reasons for that. One could be if you end up getting an epidural during labor, they will insert a catheter, because once you get the epidural, you're not going to be getting up to pee and use the bathroom. And with any procedure, there is a risk that, if you're introducing something into that area, that you can get an infection. Now, most healthcare facilities, especially in the U.S., do prep you with a good, antibacterial solution before inserting the catheter into your urethra and bladder to kind of drain that urine. But again, with any procedure, you do have that risk of, getting an infection or introducing bacteria into that area. Another thing about UTIs is because of the strenuous work you have to do, pushing a baby out, and just how much your bladder has to change from the pressure of carrying a baby, those muscles can get very weak. And when you have weak bladder muscles or weak, what we call pelvic floor muscles, it can make it harder for you to fully empty your bladder after you give birth.
Now,
So
does the same apply to women who have C-sections?
yes.
Okay.
Yes, because even if you give birth by a C-section, you still, have carried the baby. A lot of people are always, nervous about taking that first urination after you have a baby, whether you, give birth by a C-section or vaginally. And then also just being a new parent, again, you're thinking so much about the baby, like a whole day can go by and you're like, I only had one sip of water. I haven't been to the bathroom in hours. And that's the perfect place, for you to have that urine kind of being stagnant and bacteria building to make you, not feel well or get an infection. So the treatment for UTIs usually is an antibiotic from your doctor, but there are some things that you can do. Of course, you want to be having high vitamin C foods, as far as like your fruits, your fruit drinks. A lot of people always say cranberry juice, drink cranberry juice.
Right.
I'm a big fan of water. I feel like water is the cure to almost everything. So drinking plenty of water. And, of course, making sure that you're not introducing anything into that area as well. So if you're still bleeding, you shouldn't be inserting anything, in that area as far as tampons. Don't try to douche. Please don't try to douche after you have a baby. Making sure you're having good hand hygiene anytime that, you're changing your pads, your ice packs. And the most important thing is wiping front to back.
You right. Yeah.
Wipe right. I mean, it's something that some of us learn when we're little, but, again, after you have a baby, you might not even want to touch that area really that much. But it's very important to, even if you, and I'll show you later some items that you can use as new parents, but even if you're just using your regular, toilet tissue, just making sure you're wiping gently from front to back so you're not introducing any bacteria into that urinary tract. Any questions about that at all? I can't see the chat,
Yeah.
so I don't know.
So I have one. Joan underscore 24 pink says she's 1 week postpartum. So is there anything she should be super cognizant of? And then goddess underscore dream by Amadat, she said this infection could cause ectopic pregnancy. I'm not sure if that's a question or a comment, but there you go.
Yeah. I mean, it can. Any infection can. I don't know if it can cause ectopic pregnancy, but any infection can damage the way your reproductive system works, and especially UTIs. If that's not treated, it can really affect your bladder, your kidneys, and everything else. So you really want to be careful with, monitoring your symptoms and practicing good hygiene as well.
And then for the one that's 1 week postpartum, yeah, I remember 1 week after having my son, and it was a whirlwind, and I still had family. I was ready for them to go. So, so yeah. Any words of wisdom from her?
Honestly, 1 week postpartum, you're in survival mode. You know what I mean? You're just getting back home. There's a lot of things going on. So the main thing right now is to make sure that if you're still bleeding, which I'm pretty sure you are, make sure you're changing your garments regularly, you're drinking water, and you're eating nutritious foods. Those are the main things you can do right now.
Awesome. And then one just came in, which this is a good question. I've never heard of an ice diaper. So she asked, it's my first baby. My question is, do you need to use an ice diaper every day?
I love that term for that. I've never heard like it said as ice diaper, but actually cold packs are something that we are going to talk about in a few minutes, about just, ways you can make stuff at home. You can purchase stuff. You can get things from the hospital to use. So yeah, that's a great question. The second one I wanted to talk about is endometritis. So that's actually the most common infection that we see. And that is when, kind of like, if you can imagine the lining of your uterus, it gets infected. And we have to think about it, like whether you give birth vaginally or by C-section, you're really dealing with the open wound, right? Whatever passageway the baby comes out, that is now an open wound that's open to bacteria, the mucus plug that we sometimes lose right before we have the baby. Like, that's really one form of protection that we have to kind of keep out any type of bacterias or invaders from causing us an infection. So once that's gone, and you add so many people, coming in and out as far as cervical checks, and even you, like I said, changing your pads and not changing your pads, people doing all types of stuff to you. Basically, you're just open to all types of things. I know my grandmother told me after I first had my first child, she was like, you need to go sit down and rest and heal because you're open. And I was like, open? But it's true. Like, a lot of cultures have you covered up and warm and sitting down during the postpartum period because you are dealing with an open wound. So you don't want your uterus to get infected. It's very painful. Usually the treatment is IV antibiotics. So that means that you may have to go back into the hospital to be treated for that. It's actually really bad. It's really bad. So it's really important for you to be able to recognize those signs and symptoms of any type of infections, because they can easily spread from, just a UTI to something else, to you totally, having a systemic infection in which you have to spend a lot of time in the hospital.
Got it.
Yeah. It gets real, guys. It gets real. It gets real. So please take the time to rest and recover after you have a baby, because your baby needs you, we need you, and things can turn so quickly. Another one that people ask me a lot about are surgical scars when you have C-sections. How can they get infected? So just like with if you get a cut or if you get a, an open scab, it leaves your body at risk and open to invaders or bacteria. So a lot of times you will have redness at the scar. You might see pus coming out. You may see a lot of blood coming out. You may have warmth around the area of the incision. You also can I've seen people's skin around the area change different colors. That's one thing that you really need to be looking diligently at after you have a C-section, and call your provider immediately if you see any signs of infection. Most of the time, if it's really bad, your doctor will have to cut at that site again and drain out the fluid, and use antibacterial gauzes to help heal, and also antibiotic use also. So yeah.
When you just said recut, I'm like, oh.
Yeah, nobody wants to
I
go
had
through
a
that.
C-section with my son, so I was like, oh.
Nobody wants to go through that. I had a C-section too, so I've had a vaginal birth, a C-section with twins, and then I just had a VBAC. So I feel like I've seen like everything I can see when it comes to labor and
Congratulations,
delivery.
first of all.
Thank you.
You're
I've seen a
welcome.
lot.
Yeah, wow. Wow. So yeah,
Yeah.
I'm sure you can really help your patients because you've lived some of this stuff. So
I tell them I feel like I've lived 9 mommy lives already, and I'm only 32, but it's like I've just seen so much. Like I just feel like
yes.
it can get real really quick, guys. So just take care of yourselves. And another one that I deal with a lot in my practice. No, sometimes they
I
put
was
you to
gonna
sleep. Yeah, sometimes they put you to sleep. Yeah, but you don't feel it. It's nothing like having a C-section again per se, but it is painful, of course, because you're dealing with the pain from the infection, which can hurt really, really bad, and then you're also dealing with the healing again of the site. So yeah. Let's talk about mastitis, because I see that a lot in my practice. Mastitis is infection of the breast. So after you have the baby, whether you decide to breastfeed or not, hopefully your milk comes in and that can be a lot. It can be painful, and especially for those who don't want to breastfeed, I've seen more people dealing with mastitis because that milk kind of gets just trapped in the breast, basically. And again, any type of pooling of fluid, whether it be breast milk, urine in your bladder, anything that's kind of just not moving, it's a great place for bacteria to grow. And so what happens is mastitis, the signs and symptoms of that is your breast gets red, very painful. Some people develop abscesses or like hard lumps in their breast that they either have to get antibiotics for, or again, someone may have to go in and kind of drain that area to remove the infection. Some ways that you can kind of prevent mastitis is breast massage, making sure that before you kind of express that milk that you're massaging and getting any area that feels hard or lumpy. I love these little heat packs that you can use, that you put in the microwave. Heat kind of helps loosen that milk as well for you to be able to express it and get everything out. And with mastitis, the earlier that you seek help from your physician or a lactation consultant like what I am, the better, because it's painful and it can ruin your breastfeeding experience if you don't have a great care team to help you through that transition.
I just saw a question
Mhm.
about yeast infections, and is there a root cause of recurring postpartum yeast infections?
Usually it could be the amounts of sugar in your diet. Sometimes it could just be your balance off. So I always tell people who get frequent yeast infections, or what we call thrush in breastfeeding, is when you see the baby sometimes have like white in their mouth or on their tongue. Some parents see it on their nipple, or actually see it in their baby's diaper area, is to start with really increasing your amount of water. Try to cut back on your sugars and starchy foods, the stuff that we love, like bread, pastas, cakes, pies, all of that. And try to introduce a probiotic into your routine as well, and see if that helps.
Got it. Thank you.
Mm-hmm.
Cool.
Any other questions?
No, I didn't see any other ones. I've been looking.
Okay. So let's talk about some things to consider when you're pregnant. Like, so you're pregnant, you're listening to me, or you're trying to get pregnant. You're like, oh my gosh, I'm scared. I don't want these things to happen. What can I do to prepare? One of my number one recommendations, and I think I saw someone put it in the chat, is to look into a pelvic floor therapist. They help you to just learn how to effectively use your pelvic floor muscles, which are the muscles that you use to hold and release, your urine when you use the bathroom. They help you with just balancing yourself during pregnancy and after you give birth as well. And to be honest, I probably need to go see a pelvic floor therapist. I have my son, he's almost 1 now, and it's like, I thought I was recovered, but I might need to schedule a consultation with a pelvic floor therapist just to make sure everything's in working order. So that's one thing you can look into. Another thing is stock up on just some goodies. I have some here. This is, I don't want to show the brand, but this is a popular baby brand, and what this is just a spray bottle. They will give you one in the hospital after you have a baby, and you will love it. You will hold it dear to your heart. But depending on where you live, I don't know if that's a routine, of them giving it out, but here in the US, you usually will get one. And what you do is you fill this up with water, preferably warm water, and when you urinate, you kind of just spray down there, and it feels amazing. I know it kind of sounds weird, but it feels amazing after you have a baby. And another step that you could do, if you didn't want to just take water, you can find or make a really good product that you can kind of mix in it. So this mix I have has like pink Himalayan salt, baking soda, some Greek yogurt powder, some aloe vera, and you can just put a little bit, in your bottle, shake it up with some warm water, leave it on your toilet, and when you go to the bathroom, just spray down there, and it'll feel good. You'll feel fresh, and you won't have to worry about, wiping hard or risking you introducing something into your tract. Another good thing. Mm-hmm.
There was a question I just saw. Sorry to interrupt. One of the ladies asked about babies, and if a lot of hiccups is normal.
In the baby?
Yeah.
Oh, it can be. Some babies who have reflux hiccup a lot, but especially if it's a new baby, they're just really getting used to being on the outside. So hiccups is actually kind of one of their, I call them transition cues, of them just being new to the world and still adjusting. So you may see newborns hiccup a lot, sneeze a lot. It's perfectly normal. They're just kind of regulating their bodies and their senses. So yeah, that's normal.
Cool. Thank you.
That's a good question. Another thing that you can get while you're pregnant is just some good wipes to carry in your purse. This is really good. I'm not going to say the brand, but I love them. They are a Black-owned personal care brand. If you want to know, you guys can, DM me But yeah, just nice little wipes you can keep in your bag, keep on your countertop of your toilet to just wipe and just make sure that you're fresh or clean, but you're also putting good ingredients down there that promote healing, that promote a healthy vagina, that is pH balanced and free of all bacteria. Another thing you may want to get familiar with when you're pregnant, but again, talk to your provider, your midwife or physician, is the sitz bath. I love my sitz bath. We have a great relationship. But I will say I wouldn't recommend using this in the postpartum period until you've been seen by your doctor for your postpartum visit. So that's usually around 6 weeks. Same thing with baths, but sitz bath, what you do is this actually goes on your toilet seat. So imagine you sitting like this. You would just fill it up to the line. And again, you can put something with good ingredients in it, or you can just do it with just water. Some people also use apple cider vinegar, which is a great antibacterial cleanser, antifungal, but just something that'll keep that area nice and fresh and clean. I have 2 more things. I think someone asked about I forgot what she called it. What is the ice?
The ice diaper.
Ice diaper, yes. I'm stealing that. The ice diaper. So this is the one that they will initially give you after you deliver. So I'll actually open it for you because I have a million. They look different, but it looks like a maxi pad. And this one has dry ice. So I think you like twist it, you shake it, and then it becomes cold. You place it in your underwear or your nice mesh panties that they give you after you deliver. Some people
I still have 2 of those in my closet. No joke. I saw my son's 2. He just turned 2, and I had no clue what it was for. And they didn't explain the tools, so I got this thing, and I was like, "Is this an ice pack? Like, I have ice packs. All right, I'm gonna just keep it." So now I'm like, "Oh my God! I wish I would have known what it was. That seems amazing."
Yeah, I love them. I love them. And again, you can. I mean, I have 4 kids now, so I use these for anything. Like, oh, your head hurts? Cool.
Right.
Twist this and put it on your
When
head.
they get older, they're probably going to be like, "Mom, you really had that on your
head." Whatever works. Nothing,
right.
We don't waste anything over here. But some people make these on their own. So what they do is, and you can go on Pinterest if you have Pinterest, or even Google. They call them pad sickles. They take like a regular pad. They put some witch hazel, which is a soothing agent a lot of people use. Or you can put aloe vera. You can put an essential oil if you want it to smell good and fresh. And they wrap them up and they put them in the freezer. And that's a fun activity you can do while you're pregnant. Since, when we get in that nesting phase and we just want to do something to make us feel like we're prepared, that's an awesome idea, is to make some padsicles and place it in the freezer. And these are, I'm not going to say a brand, but these are pads, witch hazel pads. I got all this stuff from the hospital, y'all, when I had my baby.
The hospital hooked me up.
Yes, it was my 4th baby, so I knew what to ask for when I left. But yeah, okay, so you take your pad and you can put your little witch hazel circles on your pad and line them up. And let me tell you, you'll feel like you're in heaven. You'll feel like you're in postpartum heaven. I'm telling you, it doesn't get better than that. So yeah, these are just some things that you may see. Like Alma said, she didn't know what none of these things were. They just gave it to her and was like, here. So hopefully if you all see these along your way now, you'll be like, I remember Tiara told me about these things.
Watch this before having, like, I wish this existed before having
It is what it is. I mean, now you know. Now you know.
Wow, this is so helpful. Thank you.
Good. Any other questions that we have?
I haven't seen any others thus far, but I do have a couple of sent in, like pre-sent in
Okay.
questions. And I know some of these you've already answered, but common signs and symptoms of most infections to look out for.
Yeah, so you want to look out for fever. You want to look out for pain in the pelvic area. You want to pay attention to any discharge, any foul smelling odors, and any chills, any feeling sick, like you're coming down with something.
Awesome. Thank you. The second question, again, you've already mentioned a lot of this, but 4 common postpartum infections.
So the UTI, the endometritis that we talked about, the mastitis, what else did I say? Oh, the surgical scar infection as well. Those are like the top 4 we hear about.
Thank you. And then we just have 2 more. So things to consider while pregnant to help reduce the risk of infection and pelvic pain. That's a good question.
Yes, definitely pelvic floor therapist. Staying active also, making sure that you're wearing the right type of undergarments. Make sure you're wearing either nothing or cotton underclothes.
Like, if you're wearing thongs while pregnant, is that not okay? I see your face. I see that's probably not a
If
good
you're
idea.
wearing a thong while pregnant, I take my hat off to you because I could barely wear a thong when I'm not when I'm not pregnant. So let me bow down to you first. But no thongs, because again, you don't want to risk that bacteria from that little string in the back creeping its way up and coming to the front. So try to stay away from thongs at all if you can, but especially while you're pregnant. Yeah.
Note to self.
Yes.
Home for pelvic pain. So let's say they can't make it to like pelvic floor therapy. Are there like any home remedies for that pain?
Yes. So ice, definitely ice. You know, you can ice packs. Some people say I don't have ice packs. I hope you have some vegetables, some frozen vegetables in your house. Anything you have that's cold. You can wet a washcloth and freeze the washcloth and use that as well. What else? I'm more of a, my fiance calls me a hippie, so I'm into more like natural natural things. Yeah.
Yeah.
So like your vitamins, your teas. Again, apple cider vinegar is a natural gift that we're given to help with the cleansing and the balancing of our bodies. Witch hazel is natural, so even if you don't have these little pads, a washcloth with just some witch hazel, you can put that on as relief and for its healing properties. And honestly, your diet. But again, pelvic pain, I feel like that can be treated at home. But if you have any signs of those infections, you really need to give a call to your provider.
Thank you. Oh, someone said, "Are you a pediatrician? Because you answer these questions with ease."
Oh, oh my goodness. Well, thank you. I'm not. I'm not. My family calls me Doc because they feel like I'm a nerd and know a little bit about everything, but don't know a whole lot about one certain thing. But no, I'm not a doc. I'm a doula and a lactation consultant. But thank you so much.
Yeah, no, this has been so very informative. And this question is for me.
Mm-hmm.
What was that? I don't know if it's a cream or it was like some remedy you put together and you showed us in that jar. It was like
Yeah.
yogurt. And it sounded great.
DM me if you want the brand name of the company. I don't want to share it without permission, but you can make this at home. It's just get you some Epsom salt or pink Himalayan salt, a little bit of baking soda, some Greek yogurt powder, and some aloe vera. Mix it up and just kind of make a paste out of it. I'm just lazy, so like I like certain things I like to buy, you know, just to make me feel
Girl, you're
good.
not lazy. You have 4 kids. You need to like delegate.
Right, but you can make it at home. You can, I mean, you can make it at home. But if you guys really want to know the brand, I'll definitely DM me, and I'll be glad to share it with you.
Awesome. Thank you. So that's Tiara at Birth CEO, guys. Tiara at Birth
Yes,
CEO.
come follow me, come chat with me. I'm very approachable, so if you have any questions, I'll be happy to answer them. Because this is my thing. I just love helping families, period.
Yes. Well, thank you so very much. That's 2 questions because they're
Okay.
kind of interrelated. One lady said she had a C-section already and she wants to try the natural, like she wants to try a vaginal birth.
Okay.
And then the second part, someone else said, so if you want to do the labor naturally, how do you induce it yourself, possibly?
Okay. So for the first one, okay, for someone who's had a C, okay. Okay, that was me. I had a C-section. I wanted to try for a vaginal birth with my last pregnancy. So the first thing I did was I found a provider who was okay with me trying that. A lot of providers want you to have a C-section if you've had a previous C-section, just depending on, you know, what happened with your first pregnancy and childbirth. Now, there are situations where you may not be a good candidate for trying to have a vaginal birth, you know, after a C-section, but a lot of times, you know, it's possible. So definitely find a provider who is open to having that conversation with you. I would say the second thing is to be really active in your pregnancy, as far as making sure you're doing exercises and sitting and standing in positions that promote that baby to come down and out your vagina. So, you know, not a lot of leaning back on recliners, but lots of upright positions on labor balls, or lots of walking, things like that. And a lot of it is mental as well. So just knowing that it's possible for you, that, you know, if your doctor says that it's okay, then you got to make up in your mind, like, this is what I'm going to do. And even if it doesn't turn out the way I want it to, I'm doing my best to prepare mentally and physically to have this baby vaginally. And how to induce labor naturally. Okay, first I would say hopefully you're waiting until your baby is due to do. Okay, so we're not going to rush these babies out, guys. We're going to let them cook. But if it's getting to a time where your doctor is talking about maybe medically inducing your labor, then sex is always my first go-to as a suggestion. You know, sex, walking, the labor ball, the birth ball. You know, you can do pelvic tilts and rocks. And there's other things you can do. I just don't feel comfortable saying that over Instagram Live. Maybe, you know, get a doula or send me a, you know, message, right, and we can chat further. But sex is always, to me, like one of the safest things to try to start to induce your labor naturally. I hope that helped.
Oh, that's super helpful. And guys, I'm sorry if we weren't able to address everyone's questions. You know, IG Live doesn't like us to be on here too long. They'll shut us down. So if you guys have any other questions or specific questions to your situation, please, one, follow at Birth CEO, and 2, send her a message. So
yes, come talk to me. Come talk to me.
Thank you for this. It's been really great.
Thank you for having me. It was a pleasure.
Yes, definitely. Well, guys, it has been an amazing time. Thank you so much for tuning in. This was really, really great. It's been a little while since we've done an Instagram Live, so we are back, and you had us come back so strong, Tiara. So,
with a bang, yes.
So thank you, and send my love to those beautiful babies. Congratulations again.
Thank you. And tell your little one I said hi.
Oh, girl, he's at the pool right now. I will when he comes back. All right.
Okay.
Have
See
a
you.
good
Bye,
day.
everyone. Thank you.
Bye.
Bye.
Well, guys, as you see, that was absolutely amazing. So very informative. Like Tiara was, man. Did you learn something? Let me get some hearts and some type of emoji if you learned a lot, because I know I did, and I wish I had something like this before having my son. She is absolutely amazing, and like I said before, if you have any other questions, please, please, please follow her at Birth CEO, and keep tuning in for these. I know that we are trying to get you all the very best information. We're in this together as moms. We are in this together. So we will keep bringing the jewels and dropping the knowledge, but all the love. Tiara's getting all the love. So thank you again, guys. Have an amazing Saturday, and we'll meet again. All right. Bye.
Thank you for watching. Make sure you like and subscribe to our channel, and of course, follow us on Instagram at PregnancyBeyond. Bye bye.